Hey guys, it's Dr. Abraham with A Sip of Aesthetics. We are here with Lauren today. Hi.
Hi. Hi.
We're doing a Q&A style episode today. So we've been receiving a lot of questions from you guys, and we kind of grouped the questions that I think have to do with Botox and fillers. These kind of questions for that kind of topic for a Q&A today. So we're gonna get started right away.
Okay, so first question, how does Botox work?
Very common questions. Botox, we sometimes we say it's relaxing the muscle. Really, it's working at the neuromuscular junction to basically it works where your nerves tell the muscle to kind of contract. So by kind of interfering with that signal, our muscles kind of stay relaxed, which is why it's helpful for wrinkles because that muscle movement is what creates wrinkles in the forehead, around the eyes. And so when we're not contracting that muscle as much anymore, it has a softer look and it helps with the wrinkles in these areas.
Fantastic. Okay, what areas can be treated?
You can treat a lot of different areas with Botox. I would say the most common is what we call the glabella or the 11 line, which is between the eyebrows, the forehead, the crow's feet, which are the lines around the eyes, are super common. And those are the areas that are kind of most people think of when they think of Botox. But you can definitely do it in a lot of other areas. You can do it in the neck, a lip flip, where you use some Botox right around the lips to give it a little bit more kind of volume is a very common treatment. It can be used in the bunny lines. It can be used in the chin and the jawline for what we call a gummy smile, where you show too much gums when you smile.
You said the neck too, right?
Neck for sure. And you can also use Botox in things that are not related to aesthetics, like headaches,
Underarms,
underarms.
hands.
Yeah, you can use it for the hands for somebody who has hyperhidrosis or they sweat too much from their hands. You can use Botox for that. You can use it
Perfect.
in the soles of their feet, and a bunch of other stuff in the traps, for a couple reasons for tension, but also sometimes people, they want to get a slimmer look in that area and you can use Botox for that.
I love that. Okay, next question. I am 47 years old. How many units will I need?
It really depends. First of all, it depends because we just talked, you can be doing so many different areas. These three most common areas we've talked about, the 11 line, the forehead, and the crow's feet, kind of the standard amount of units there is 64 units. Not everybody gets 64. Most people get a little bit less. Sometimes people will get a little bit more. It's gonna really depends on how many lines you have, how strong your muscles are, how big the area is. But I would say if you're doing the three most common areas, somewhere around, 40 to 50 is just a rough estimate.
Okay. And then how long does it take to see results?
So Botox usually starts to kick in relatively quickly within 2, 3, 4 days. Most people will start to see some results. Now it can be a gradual process. We always tell our clients to give it like about 2 weeks before they really see the full effects. But again, it starts a little earlier. Sometimes people within 2, 3 days, sometimes even less time, they'll start to see some results. But again, might not be the full effect. It gets a little bit more relaxed every day. I'll continue the process for about 2 weeks.
Perfect. Okay, so can you stop Botox once you start?
Yeah, of course you can stop Botox once you start.
And will anything happen if
No, you'll just get some of your lines back.
Okay.
But no, definitely you can do Botox if you're not sure and you can do it one time, see if you like it. If you don't like it, you don't have to continue with it. It's cleared out of your system relatively quickly. It's relatively a very safe medication. I'll tell you honestly from my experience, most people who start Botox, they don't stop after 1 or 2 times just because they like it a lot, so they end up kind of continuing with it. But you can do it one time and stop. You can do it 5 times and stop. You can do it for 20, 30 years and stop, and there shouldn't be any issues with that.
What qualifies me as a candidate for the procedure?
Most people, as long as you want to relax these muscles and you have to be obviously like a certain age. And again, the age that's appropriate for Botox is going to vary depending on each person. We don't typically, see anybody under 18, for example, but, sometimes people will start doing it in their 20s, sometimes in their 30s, sometimes in their 40s. So as long as you don't have any contraindications to Botox, and there aren't a lot, but there are some contraindications. For example, if somebody's pregnant, we usually don't do it. There's some, usually rare, but there are some neuromuscular disorders, and genetic disorders that if somebody have, they might not be a candidate for Botox. Which is why you always want to do it, with somebody who's licensed, somebody who's professional, because you still want to go through your history, go through the medications you're doing, and see kind of what's an appropriate treatment for you. But most people do qualify as long as they're starting to see wrinkles, they have too much movement, and they want to soften it. And as long as they're not pregnant and they don't have any of the certain conditions that would be contraindications.
Awesome. All right. We do get this next question a lot. Can I do the treatment if I am pregnant or breastfeeding?
We don't typically do the treatment if you're pregnant or breastfeeding, just because it hasn't really been studied, significantly in patients who are pregnant or breastfeeding. And if we're doing it for cosmetics reasons, just to be extra safe, we avoid people who are pregnant or breastfeeding.
Okay. And then what should I do to prepare for the treatment?
So you want to avoid, I would say, if you want to be extra safe, I would avoid any blood thinners if you can beforehand, just to kind of minimize the risk of bruising. So these would be things like certain medications like blood thinners, but also alcohol, as you're mentioning. Some of the medication that can thin your blood a little bit too are like aspirin, ibuprofen, Advil, Aleve. So if you can stop them and you don't have to take them, I would avoid them for a few days before. There are some supplements that also sometimes can cause a little bit of increased risk of bruising. Fish oil, turmeric tend to be some of these.
Because we have patients come in, they're like, I had one glass of wine. That's fine, right?
Yeah, and these are, what we call these aren't like absolute contraindications. It's not like you can't do it. It's just your
Something
risk
to
of
avoid,
bruising
yeah.
might be increased. But if somebody comes in, they're like, I
had a
came
bottle of
in,
wine,
I've
they're
had some
totally fine.
wine, but I'm here, I need to do the treatment.
Yeah.
I don't care if I get, a couple
Bruise a
extra
little bit.
bruises.
Okay.
It's fine. The Botox will still work. It's not going to
Perfect.
affect the outcome. It's just the bruising.
Okay. Patient comes in. She's been doing Botox for 10 years, but lately it's not lasting as long. What are some things or tools or any suggestions for them to do? Switch the toxin.
Yeah, I mean that is a possibility. It could be a lot of things. Sometimes we see that where people after a while, it's not working as much. It could be a couple things. Sometimes you just need to increase the dose a little bit, especially if they started early on and they started with a lower dose and they never kind of upped it, or if they're going longer and longer between the treatments. It might just be that they need few more, a little bit more, a few more units. Sometimes people can get a little bit of resistance to treatment. You've mentioned switching it. There are a couple other, FDA-approved neurotoxin, neuromodulators on the market. Botox is the most commonly used, the one that people are most familiar with for the most part. But Dyspro is also out there, Xeomin, Jeuveau, Daxxify. So sometimes we've seen that where people, even though they all kind of have botulinum toxin type A as kind of the active ingredient, but it's kind of like slightly different forms of it. So sometimes people can react a little bit more to one. So I've seen that where somebody starts to get resistance for once and we switch them to something else and they kind of get that longer duration again, or the kind of more obvious results.
Have you
again.
seen the resistance from everything? Like, have you had
Yeah.
a patient come in and they're just resistant to toxin in general?
Yes, because again, they all have botulinum toxin type A, so they
Why
are
does that
in a
happen?
sense more similar than they are different. So if
Yeah.
somebody, has kind of developed antibodies to
Okay.
it, and it's not working for them anymore. It's not very common.
Okay.
And it's also kind of like relative to, whereas sometimes people will see less results. Like they'll tell me, okay, it works, but it used to last me 4 months. Now it's lasting me 3 months. Or I used to need 40 units. Now I need 60. So it's not usually to a point where it's not working at all. I mean, these people do exist, but it's not common at all. So it's, kind of relative. It's sometimes people have, slight resistance, more moderate, more severe resistance, depending on each person.
I love it. Okay, so we're going to switch topics. We talked about Botox, so we're going to talk about fillers,
Okay.
which is, common in our practice. We do a lot of fillers here in the office.
For sure.
So can you talk to me about the different types of fillers out there?
Yeah, I mean, there's a couple different ways to look at that question. There's different, when we're talking about dermal fillers, we're talking typically about hyaluronic acid fillers, and there's kind of different types of that. But there's also, things that are not hyaluronic acid filler, like Radias, for example, which is not made of hyaluronic acid. But typically, a lot of people, when they're talking about dermal fillers, they're talking about Juvederm, Restylane, RHA, Avelis, which are considered hyaluronic acid fillers. So, as the name suggests, they're made of hyaluronic acid, and as the name suggests, they meant to fill or give a little bit more of volume or reduce volume, which is why people use it. Like in the lips, for example, to give a little bit more volume, make it a little bit more plump. It can be used in the cheeks, in the jawline, in the chin, wherever you want to add a little bit more volume, a little bit more definition. Just like we were talking about the Botox, there being like different kind of brands, Botox, Dysprosium, and you kind of have a similar situation with fillers. There's the Juvederm family of
Restylane.
fillers, Restylane family of fillers, RHA kind of family of fillers, Bolotero is another one, Versa. Now, when I say family of filler is because even within Juvederm, there's different types of fillers there. So there's
Yes.
like Juvederm Voluma, Juvederm Volux, Juvederm Volor, Juvederm Volbala, Juvederm Ultra, Juvederm Ultra Plus. So all of these names, and then you also have several under Restylane, which can be a little confusing if you're not, too familiar with the topic. But the reason Juvederms has a list of different fillers is because they all have slightly different properties.
And they can do
So
different things too.
exactly. Oh,
Fill,
yeah, they
fill
can.
different places in the areas
Exactly.
that you want. So cheeks or lips or jaw or whatever, what have you.
Exactly. Our face, if you look at your face, it's not the same everywhere. Like there are
Yes.
areas
So
where
one
this
filler is not going to do everything for the whole
exactly.
entire area. There's different fillers for different
Absolutely.
places.
Some places we have, thicker skin, the muscle is different, the amount of fat there is different.
Yep.
So yeah, certain fillers are gonna be more, they're gonna sit better in certain areas of the face, like in the cheeks as opposed to in the lips, as opposed to the under eyes, for example.
This is actually a really popular question. Can fillers be reversed? And if
Yeah.
so, how do you do that?
Yeah, in a sense, they can be because you can use something like hyaluronidase, which breaks down the hyaluronic
And
acid
that's
bonds in the
dissolve,
filler,
right?
and that kind of helps dissolve it. So if
Okay.
it needs to be gone, typically fillers do break down with time. I know there's a lot of like information and controversy out there about how long they last, and some of them like not breaking down as quickly as we've thought, or but overall, you can also inject a solution to help break down fillers. So if and also something that is unfortunate that sometimes can happen is complications with fillers. Not common, but they can happen, and you want to be ready. And in these cases, reversing the filler can be can a lot of times resolve some of these complications. But it can be reversed for the most part with the Hylanex is probably the most commonly used product to help reverse some of the filler if needed.
Perfect. Okay, so like Botox, what should I avoid after the treatment? Same thing?
Yeah, similar stuff.
Like,
Things that can increase your risk of bruising and
okay.
swelling, that kind of stuff. We want to keep the area clean, after the treatment. I think with Botox, we've kind of talked more about before. But after, fillers, you also, because we are poking the skin, one of the main functions of the skin is to protect you from outside toxins and outside bacteria and, problems that can come from the outside. So when you do a needle, you're breaking the skin barrier. You want to give it time to heal. And you want it to heal appropriately, and you want to keep the area clean, not to get any dirt inside.
One person asked, I want my filler to be natural, so how do I achieve that?
Oh, honestly, most of the clients we have want that, and we are
Natural approach.
exactly, and we pride ourselves on being able to
Yes.
do very natural results for the clients who are asking for that. I think when filler is done well, a lot of times you're gonna be meeting a lot of people who have fillers, and you would have no idea that they have fillers.
Yep.
Because fillers can be overdone, and a lot of times for some people when they think of fillers, the first thing that come to their mind is like that picture of somebody who has like really elevated and high cheekbones that are a little bit out of proportion with the rest of their face. And yes, you can overdo fillers and it can look unnatural, But I think again, most people don't want that, and you can definitely make it look very natural. And most people are gonna be walking by people who have fillers in their face all the time and kind of have no idea because it just looks like their skin's little. In fact, when filler is done right, it's gonna restore the proportionality to your face. It's gonna make it look more symmetrical, more proportional, as opposed to abnormally proportional.
When I think it's like we've talked about this before, finding the right provider for you that does that approach and is good at what they do and is very educated and has experience. I think that's very important when you go into doing different things like this because yes, it could be very dangerous if you're not with the right provider. So I think just that finding that person that works well with you and can achieve the goals that you want.
100%. And you have to talk about your goals with that provider and make sure that you guys are kind of on the same page. Sometimes people come in and they have an idea, but we kind of have to clear their goals and expectations beforehand because they either have unrealistic expectations or maybe they're scared. They think, if fillers touch their face, they're going to look like a balloon and they're never going to look natural again and again. That's not the case. Unfortunately, it can be overdone, and there are cases where it's overdone, but that's not like the norm that we want.
Perfect. Well, thank you. That was awesome. That's it for now, but I know that all of you still have a lot of questions to be answered, so please keep sending in your questions for us. We love to read everything that you have to say, and we'll try our best to get to everybody. So it was great.
Thank you guys for watching. We tried to kind of do the Q&A related to the Botox and filler in this episode. So I know some people have asked other questions that maybe we didn't include just because they're a different topic, but we're going to be doing more Q&As, episodes and kind of focus more on a different topic each time. Make sure you like and subscribe. Thank you guys for watching and see you next week.
Thank you.
Awesome.